Hey everyone, welcome to another video. Today we're going to look at something new. We're going to look at physical therapy topics, and this will be a playlist that you'll find soon on our YouTube channel. Physical therapy topics, we'll break them down by the most common ones, and today we're going to look at the frozen shoulder. So the frozen shoulder is technically called adhesive capsulitis, and it's typically something that people suffer. About 5% of the population ends up getting this at some point. There's a couple other factors that contribute to this. Tends to be more women between the ages of 40 and 60. I mean, it can be men too, but it just tends to be demographically more that way. And it also tends to affect people who have already had it on one side. So, for example, if you had it on the right side, it tends to be the case that down the line you might get it again on the left side. So it's characterized by three phases. Basically, you have the freezing phase, which is basically that you'll get painful, restricted motion. That phase can last anywhere up to between 6 and 8 months, more or less. Then you get the frozen phase, where you might not have pain, but you're just blocked. You can't really move your arm a whole lot. And then you'll get the thawing phase, where again, you'll be dealing with a little bit more of the pain again, but you might start getting back a little bit more of your range of motion. It's also a pathology that self-clears up, self-resolving. So although it does take quite a long time, typically within 18 months, so a year and a half, even if you do absolutely nothing about it, it will resolve. However, it can be very painful and debilitating, so I'm going to show you a couple things today. Really, one good tip that you can use to help yourself with this. There's a lot of videos online, and there's a lot of exercises online. I have not seen this exercise yet, so this is something new. And just real quickly, if you think you might have it, what you're basically going to feel is you're restricted in a couple ranges of motion. Like you won't be able to go back too far this way. If you have your arm like this, you won't be able to lift your arm very much this way. You'll also be limited going this way especially. This is going to be a big one. You won't be getting very much higher than this. And of course this way too. So these are all planes of motion. This is abduction, this is flexion. But basically what you're going to see typically, to keep it simple, is people are not going to be able to raise their hands too high. Now that's going to influence a lot of the things that you're going to do to compensate for that. So you might end up using your other arm more. You end up sleeping on the side that doesn't hurt. So the reason why we're offering to you a tool to deal with at least some of the mobility and the pain is so that you can live with it in the best way possible, even though it can be pretty restrictive as far as pathologies go. So what I'd like you to think about is you need a round, hard ball. It can be like a baseball. It needs to be harder than a tennis ball. Sometimes if you can find a lacrosse ball, that's ideal, or even if you go to like a dog and cat store, pet store, they have the balls that you can toss to your dog that are a little bit harder. Those are perfect too. And what you're going to do is you're going to place the ball on the ground, and you're going to place the ball between your shoulder blade and your spine, halfway up on your shoulder blade. So what I'm going to do here to demo it is basically set myself up in the position that you'll be in. And once you're in that position, your head down, you're already going to feel that this is not very comfortable. And even for a healthy person, this is not a very comfortable position. But at first, you just want to kind of rock onto the ball so that it starts to massage these muscles. And I'll explain to you in a second what these muscles are, but pretty much what you're looking for is the levator scapula. It's the muscle that lifts up your shoulder blade. And since your shoulder blade not being able to lift up is part of the reason why the shoulder is frozen, this is why if you loosen up this muscle, you can start to get into more mobility. Now, once you loosen this up, and this is a pretty painful thing, so just already kind of prepare for it, you want to prop your chest up so you get your lats to lift a little bit as well. And that's important too, because your lats are tied into your whole shoulder complex, and they're going to be contributing to your restriction. Now, this is how the exercise goes. You start with your arm in front of you, and you bring your arm towards your opposite pocket of your pants. Right around here, you're going to get into the first kind of restriction, where you're going to feel like it's not so nice to go through this area. What I want you to do is go very, very slowly through. As you come around, you're going to almost like wipe your brow with your arm and as you get to basically right around here, you're going to get to a heavily restricted area that's going to feel pretty bad. What I want you to do is just stay here for a moment, let the pain kind of be part of what you're working with, and then just feel like your arm stays low. Keeping your arm low, you're going to slowly bring your arm through. This is going to be the critical junction where you're going to have to slowly pass through, very slowly, and you've made your way through a circle. Now, that's going to be painful, so just accept that. But in time, the more rotations that you do, the more that will loosen up, and then the more you'll be able to use your arm. So let's look at it one more time. Remember, it's a very slow exercise. You go first to the side. You're going to hit something here, so be careful as you pass through it. As you come around, you're going to get into the hard part, which is basically once you cross your head. You rotate your palm up. You go very slow here because it's not going to feel very nice. As you get to the critical part, which is right around here, you want to keep your arm low. As your arm stays low, you go very slowly, very slowly, very slowly through, and you come all the way through. Now, what you'll have seen probably in other videos is people doing pendulum style exercises. That's basically what you're doing, but you're using gravity and the ball to set up yourself as a kind of deep tissue massage using the weight of gravity. It's a much more intense way of doing it, but that's why I feel like it's highly effective. Again, you just need a little ball, a hard ball. If you really want to be creative, you can find something around the house that just is hard enough and round. This is going to be something that will definitely help you. If you have a very stiff neck and it's hard for you to just lay like that, feel free to put a pillow underneath your head. And I'd like you to basically try to get to 10 passes. Now, that's something you want to do at least once a day, and the more you do it, the better results you're going to get. And in time, what it'll allow is for your arm to be able to come back up into full range of motion. So, this is a just quick tutorial on how to deal with the frozen shoulder. We'll be having more physical therapy videos in the playlist that I will make for YouTube. And these kind of things hopefully will help you to resolve your issues or at least manage them a little bit better. Thank you guys. Hope to see you again soon, and be well.